Hello everyone, my name is Azaria Lowe and I am a freshman here at the University of the Bahamas. Today my social justice issue is on the lack of healthcare in the Bahamas. During my presentation, I will talk about each of the three rhetorical appeals: logos, pathos, and ethos. On September 2nd, 2019, my island was faced with a Category 5 hurricane, the strongest hurricane to strike in the Bahamas since 1851. Due to this, many lives were lost, along with the infrastructure of many government buildings and homes, which resulted in our hospitals sustaining major damages, where many doctors and nurses had to adjust to field hospitals, which were made out of tents. Logos, which appeals to facts or reason, states that many more deaths can be avoided if we had the proper healthcare facilities here in the Bahamas, because it would reduce the large amount of individuals that would have to be airlifted to the United States if we had the proper healthcare here at home. Ethos appeals to character or morals. It is morally unacceptable for a country that has 385,000 people in a modernized civilization to not have adequate health care. This is extremely wrong, especially when its government spends money building and buying hotels to accommodate its tourists. It is just not right. Why is it that the government refuses to build a new hospital that can accommodate thousands of Bahamians? The government that the people voted in refuses to build a new hospital that can help and save many lives. Pathos appeals to our emotion. It is extremely heartbreaking seeing all of the innocent lives that are taken away because the government is failing to meet the needs of its people. An article in the Tribune stated, "I knew what they were doing were wrong. Aiden died. Don't let it happen to you." Despite the majority of Bahamians being covered under the National Health Insurance, there are still many Bahamians without coverage, and either they fail to get medical treatment they need, or they suffer to afford the costs without going into bankruptcy. In our culture in the Bahamas, many individuals are unable to afford private health care. Thus, they are forced to refer to government-owned hospitals and clinics. While some government-owned healthcare systems may be flawed, here in the Bahamas, many doctors and nurses have studied abroad in the US or Canada, where they are fully qualified for their jobs. However, some individuals are not as lucky to receive treatment from these highly skilled professionals. There are many ways that we can combat our lack of health care. The purchase of new technology will greatly help to improve our hospitals. Many computers can be bought to assist nurses and doctors with electronic health records, electronic medical records, and computer-based patient records. We can also assure that our Bahamian doctors are qualified so that we can hire our own. This would greatly help our healthcare facilities because there may be a time when foreign doctors or nurses may not want to come to the Bahamas, and we can always have our own to fall back on. Lastly, building our hospitals with the proper building code so that they are able to withstand natural disasters. This would greatly help our hospitals. If they are built off of the ground, we will never have to worry about major flooding or damages that will be done to the building. These are just some of the approaches that we can take in solving our lack of healthcare facilities here in the Bahamas.